welcome back to Rocket Right. I am bubbly Betsy Barnes. I am here with Dr. Kay Solar, who is a very well-seasoned OBGYN, and we're going to be talking about...
That's why I'm wearing the glasses.
That's right, because she looks smarter with the glasses
so seasoned. That means I'm over 50.
That's right. When you
start needing these to see things.
That's right, because we can't read without them. So.
That's it.
As you know, October is Breast Cancer Awareness Month, and we are in great support of all women having a mammography. And so I see you brought some cookies, and they kind of look like pumpkins, and I've noticed like a whole different set of billboards around town
that say Save the Pumpkins.
Save the Pumpkins.
And they're not talking about those very expensive orange pumpkins, because apparently, did you know that real pumpkins, they're hard to get this year, and they're more expensive. But these are very expensive, and we want women to protect them.
You
right?
want them to protect the breasty pumpkins.
Yes, so one of the campaigns, if you see on billboards, it's Save the Pumpkins. And so I know people might have looked at our display. They might not have been able to see it really well, but on the pumpkin platter, there are two, and these are from Crumble Cookie, because my hairdresser keeps telling me that it's the best cookies ever. And so I brought you a pumpkin one.
Thank you.
It's like an entire cake and a cookie. It really is. You know.
It's big enough to be a cake and a cookie.
Mm-hmm.
It is. You know, one of the things that's so important is that women and men encourage each other to get cancer screening, regular cancer screening. And, you know, we have all had people that are touched by breast cancer. We have people that we have loved that have been through quite a journey. Last week, we had Bust Out for breast cancer. We had Courtney Edwards, who had been diagnosed at 28 years old with no family history of cancer. And she survived that over 12 years. She is a beautiful, dynamic, amazing woman. My mother actually was diagnosed when I was 30 with breast cancer, and at the time she was 61. And so I was living temporarily in another country, and had just changed my ticket to stay 3 months longer. Found out that my mother had breast cancer, changed my ticket again, and came back. And although I wasn't here for her surgery, I was here to take her to radiation. And later, 10 years later, that cancer metastasized into lung cancer, and then 4.5 years later, metastasized again. So we had a lot of extra time with my mom, but it started with a very small lump that unfortunately was not detected a little bit sooner. And we're thankful for all the people that took care of her through that time. And my mom has been now in heaven for almost 15 years. And so breast cancer is always a very sensitive subject with me. It's also a very emotional subject. I know so many women who have battled and won, and I've also known so many women who have inspired me, who have really reminded me to constantly get my mammogram. And you diagnosing women for so many years, generations actually, almost 30 years in practice.
Well, I think that, you know, when you talk about that, when you look, the statistics are pretty daunting, in that 1 in 8 women will develop an invasive breast cancer during their lifetime. So that's 13% of women. It sounds
and
like
it doesn't just affect
more.
The women, it affects everyone who loves that woman, everyone who knows that woman. And so the most important thing is getting the diagnosis early and then getting the treatment.
And the biggest thing is screening. In October, we see the pink billboards, we see all of that. It makes us think about, have you had your screening? And, you know, a lot of people missed out on that during COVID.
Yes.
One, no one was going in to get any type of screening test. And then sometimes, you know, that year slipped by. But now everybody really needs to be looking at it and say, am I due for my mammogram? Have I had my mammogram? And sometimes that's confusing for women because they see different criteria. And, you know, we had some guests on a few weeks ago, and when you ask almost anybody, it's like you should start screening for the general population. That does not mean if you're at greater risk or family history, because that might start sooner. But for someone, a woman in general, the answer is at age 40 and annually after that.
I think
Correct?
that's too late. I think you should start at 25, and if you have any
there's reasons that is not, because of the numbers. And of course, you know, when you have someone who's really young, it's not necessarily that they need mammogram screening. The reason it's not recommended at a really young age is because the breasts are very dense when you're young, and it's very difficult for those mammograms to pick up things. But statistically, you know, it's less likely for someone who's young. But someone like Courtney, it does happen. And a lot of times women just think, oh, if they're not doing breast self-exams, sometimes they don't recognize that lump.
Or they ignore the lump.
Or they think it was a
cyst
cyst or something like that. So the important thing for all women of every age is if you feel something different, and so there is a place for breast self-exam so that you know what your breasts normally feel like. And if you feel something different, then you go in and get that checked. You just don't assume that you're younger than it should happen to. But for mammograms...
Don't you think there used to be a bigger thing about self-breast exam, and there's not as much
Well,
talk
the
about it
reason
anymore?
is because you used to go to your doctor's office and you would like pick up the little thing and you go home and do it. And some of the literature said, oh, that makes women worry too much.
That's ridiculous.
Nothing to that. And I still say so many women pick up their own lump and they come in and get it checked. And especially in that age range when you normally wouldn't even, you know, be having mammogram screening, because you want to find things. Mammograms are to find things before you would feel a lump. But yes, I truly believe that there's a place for breast self-exam and to come and get that checked. There is also a place for a clinical breast exam by your physician every year. The mammogram does not displace that. I mean,
No,
that is
you've
very
gotta have
important.
more than one
Your
way of
physician
screening.
may be able to feel something, and that would need to be evaluated even if the woman had a negative mammogram. But the answer is typically 40 and annually after that. But there are some, like the U.S. Preventive Task Force, which tried to say, you know, start at 50 in every 2 years. And so sometimes there's a disparity between sometimes a physician may tell a woman that, her gynecologist typically isn't. You know, when you look at the societies like the American College of Radiology, the Society of Breast Imaging, they all recommend still 40 and after. And I thought about talking about this because I did have an article just this week in one of my medical journals that said they surveyed like over 600 screening centers, and 90% of them recommended that you do 40 and annual after that. And part of that reason is, why 40? Why not follow the U.S. government preventive task force recommendations, right, and start at 50? Because 17% of all breast cancers are diagnosed in women in their 40s. So why would we want to not screen those women?
Right.
It's crazy. And so I certainly believe that. I think most physicians will tell you 40 and annually. That's something certainly to discuss. But if you get any differing information, you just think about those 17% who are in their 40s.
But if you are doing self-breast exam and you feel that you have fibroids, or you feel lumps, or you feel a density, why not take the next step and have your doctor exam and then go to the mammogram?
Well,
because
right.
it's not
Well,
terrible. It takes a few minutes and you're done.
Yes, your doctor's gonna check that out. Then they're gonna say, do you need an ultrasound? Do you need a mammogram? They're going to get that diagnostic test. Then you may need a biopsy to know, is it something that's benign, or is it cancerous? Because there's a lot of things that are benign. And
Listen
thank goodness
to
we
your
love it
gut.
when we tell people that it's something benign.
Yes.
But you always want to rule out breast cancers, because the earliest they're detected, the best chance of survival that a woman has. And so I think we want to really make sure that every woman is going to see their physician, getting their annual checkup, talking about, are they a candidate, for a mammogram, and if so, that they're up to date with their screening. And then there's so many things, and I know we talk about this a lot, and we've mentioned it before, but in addition to your screening, the better you can take care of yourself. I mean, there is data that shows if you exercise, if you eat healthy, if you maintain if you don't smoke, if you maintain a normal body mass index, your likelihood is less, not just for breast cancer, but for other cancers as well.
One time my son and I were going to New Orleans, and they had this campaign called Save the Tatas, and it was on a radio station in New Orleans, and I was shocked. He's like 8 or 9 years old, and I'm like, And he's like, tatas, he'd not heard the term.
Right.
And so
It's
I just
not
thought,
really
and it was
necessarily a medical term
yeah,
there.
but it was kind of funny. But the thing is that it's not just women that need to be reminding and listening to their own little inner voice. It's also the men and the children and the families in your life that need to remind you, it's October, let's go ahead and scan. And the same thing, conversely, for any type of cancer, and that's why there's all this fundraising for all these different organizations,
Right.
Mary Bird Perkins, Our Lady of the Lake Cancer Center, Women's Hospital, and all the other programs, because there's free screenings available.
Absolutely. And since
And if
you
you're too
mentioned-
scared to go, we'll come hold your hand. Okay, we'll hold your hand and encourage you or talk you through it on the phone and say, look, it's going to be 15 minutes. Just go ahead, do this, and then you don't have to worry about it for a year.
That's right. That's right. Well, you do. You need to check on a regular basis to make sure nothing changes during that
That's
year. But anyway, that's all we have time for.
Save
and
your
I've got lots
tatas.
more information, and she may quiz me another week or so.
We might do
Just
that
saying.
again. And we're going to be right back with Stick New Church. He is the general manager of Rouge Creole, and he's going to be talking about the new opening of Proverbial Wine Bar, part of Citigroup Hospitality. And we are looking forward to talking to Stick. We'll be right back.